Why so many people are dying from medications they were told were safe. Every year, thousands of people die by suicide shortly after starting, increasing, decreasing, or stopping certain prescription medications. Many of them had no prior history of suicidal thoughts. Their families are left asking the same devastating question: why didn't anyone warn us this could happen? Hello, I am Dr. K. Paul Stoller, and when I was a medical student on my psychiatry rotation, I was given a patient to interview, a 15-year-old boy, who was now an inpatient for severe depression and suicidal ideations. I found out he was on the drug mycelium, well known to cause depression and suicidal thoughts. Well known if you read up on the drug. When I presented the case on rounds, I said that the boy needed a different anti-seizure drug, not group therapy, as an inpatient in a psychiatric facility. The boy's attending psychiatrist lost his shit when I said this and was so angry he could barely contain himself. I can't verify what was going through his mind, but I am sure he didn't like feeling like a fool when I described the known side effects of this drug. So, today, I'm sharing a bold new patient safety proposal that could save lives by finally focusing on early neurological warning signs instead of waiting for the worst to happen. Our current system is built wrong. Doctors are trained to match a diagnosis to a pill, but very little attention is given to how a specific person's nervous system might react to that pill. By the time suicidal thoughts appear, dangerous neurological changes like akathisia, extreme agitation, emotional blunting, depersonalization, or sudden impulsivity may have been building for days or weeks. We're waiting until someone is already in crisis before we act. That's not safety. That's too late. There are 6 practical changes we urgently need. 1. Stop just saying, may cause suicidal thoughts. Tell patients what neurological distress actually feels like in plain language. 1. Require structured check-ins during the highest risk periods, when starting, increasing, switching, or tapering medications. 1. Move beyond, how do you feel? Use sleep tracking, cognitive tests, movement analysis, and autonomic nervous system measurements to catch problems early. 1. Consider a patient's history, genetics, and previous reactions, not just their diagnosis. 1. During high-risk windows, doctors should routinely discuss temporary firearm safety and other protections presented as standard care, not judgment. 1. Create a real tracking system for severe neuropsychiatric reactions so we can finally learn from these tragedies instead of repeating them. This isn't about being anti-medication, it's about being pro-safety. We can continue offering necessary treatments while dramatically reducing the risk of catastrophic outcomes. The goal is simple: recognize the road to crisis, not just the destination. If you or someone you love has been affected by medication-induced psychiatric changes, you are not alone. Comment warning signs below and share your experience. Share this video with every doctor, patient, and policymaker you know. Real change begins when we stop pretending these tragedies are inevitable. Subscribe for more content on medication safety and patient rights. Together, we can demand a system that actually protects people.